So today we're going to look at a really important topic, antenatal care, and specifically gestational diabetes. So let's start with this question. So the correct answer here is D, 7.8 millimoles per litre or more. And it's a tricky question, and that's because this threshold recently changed in the most recent NICE guidelines on diabetes. On top of that, the reference range is very different in gestational diabetes than it is for someone who's not pregnant. So in the normal population, on an OGTT at 2 hours, we'll be looking for a threshold of 11.1 millimoles per litre or more, so that can be a distraction. Other distractors here, 5.6 millimoles per litre or more. This is the threshold for gestational diabetes on a fasting glucose rather than the 2-hour oral glucose tolerance test, which is the preferred method. OGTT is the preferred method for gestational diabetes. So it's a tough question. So let's have a quick look now at some of the risk factors for gestational diabetes. So this lady had 2 of them. So she had a body mass index of 30. She also had a family history of diabetes. Having a family history of gestational diabetes is not a risk factor, but having a family history of diabetes in a first-degree relative is a risk factor. Okay, a couple of the other risk factors: having a previous episode of gestational diabetes in a past pregnancy. That doesn't apply to this lady; it's her first pregnancy. But also having a previous macrosomic baby with a weight of 4.5 kilograms or more, and finally being from an ethnic background with known high prevalence of diabetes, for example, Afro-Caribbean or Asian. So these are some of the risk factors for gestational diabetes. So I hope that's been helpful. Please do join us again tomorrow for another issue of the 30-day challenge. Thank you.